Hi, my name is Dr. Lee Newman, and for the past 30 years, I have worked with tens of thousands of patients, many with low back pain. I've learned in the real world what causes low back pain and how to effectively care for it. During the last several weeks, I've spent a lot of time putting this webinar together so that I can share with you what I've learned over the past 30 years. It is my goal tonight to help you turn the corner with your health concern. Now, this presentation is so new, in fact, I've just been editing some of the slides, and there could still be some grammar and spelling errors. If you do see any, please use the chat box and let me know so that I can fix this presentation going forward. Thanks a lot. A little bit of housekeeping. So depending on how you're accessing this webinar, whether on a computer or a phone or a tablet or some other type of device, your settings may be full screen or not. I will be sharing some links during the presentation, so I would encourage you to start at least in full screen. Make sure that your volume is up. Additionally, I'll be answering questions later in the webinar. So again, use the chat box to ask any questions that you have as I'm going. If I'm unable to respond to your question directly on the webinar, I'll make sure to try to get you by email in the next day or so. So if everybody's ready to start, let's do it. So unfortunately, it's a well-established fact that 80% of all Americans will experience at least one episode of acute low back pain in their lifetime. What may be less well known, but just as tragic, is that it is estimated that 1 in 3, 33% of Americans suffers from chronic pain. And according to WebMD in March of last year, low back pain causes more disability worldwide than any other condition. So if you are on this webinar, you probably already know that the low back pain is a serious worldwide condition, and for many people, relief can be elusive. Not knowing what to do and who to believe is common for many low back pain patients. From doing nothing at all the way to surgery, there seems to be no guarantee and often no consensus of agreement that anything will ever get better. If you look at this situation another way, I was recently able to attend one of our Pirate games, and again, the stadium was sold out, which is not even, but let's say 40,000 people. So at a sold out Pirate game, 32,000 of those people will or have experienced low back pain. 13,000 of those people live with chronic pain, and here's another statistic. It's estimated that 2,500 out of 40,000 people are likely to have back surgery in the next 12 months. So low back pain truly is an epidemic and an endemic, meaning that it is widespread and it affects just about every type of person. Unfortunately, to me, it seems like it's getting worse and it's devastating. So imagine not being able to enjoy a ball game like this, or a round of golf, or playing with your kids, or to do serious training for the marathon, right? Any part of your life can be in jeopardy when a low back pain episode occurs. In fact, anything that you do, any role that you need or want to function in, can be affected when your back is a problem. In this webinar, I want you to learn 3 main things. Where does low back pain come from? We'll talk about 4 major conditions that cause low back pain. What can you do at home starting today? Right? If you can help yourself, why not do that? Third, what are the current treatment methods to help you develop a game plan for what to do next if you need to? So we have a lot to cover, not a lot of time. We're going to move fast. Make sure you take good notes. Also, as I said, feel free to ask me any questions in the comment box. I'll get to as many of those as I can later. All right? So just for attending today, as I told you, I'll previously have an offer at the end of this webinar, but just for attending today, regardless of whether you want to take advantage of my offer or not, I'd like to be able to get to you my new PDF 5 stretches that every person with low back pain should be doing. It's step-by-step instructions, very effective for most people. They're easy to start, yet they're challenging to master. So I think everyone should be doing low back stretches. Certainly if you know that your back is an issue, this is a great giveaway. We sell it for $49, but I'm happy to include it as a little bonus for you attending tonight. So as with anything else, your first question should be, who am I and why should you even bother to listen to me? So again, my name is Dr. Lee Newman, and I'm a second-generation chiropractor. I was born and raised in a chiropractic family. In fact, some of my earliest memories are hanging out at my father's office and seeing the great number of patients to come to see him for all types of conditions. Personally, after Little League in Swiss Elm Park in the city of Pittsburgh didn't work out for me the way that I had hoped that it would, there was nothing else that I wanted to do than become a chiropractor. And I dedicated myself and accelerated my education. And here's a photo of my graduation at age 23 from Life University in Marietta, Georgia. And shortly after that, 30 days after that, I was able to open my practice on the south side of Pittsburgh on East Carson Street. And during the next decade, was able to grow to be one of the largest practices in the area, serving thousands of patients, many with low back pain. Working day to day with these patients taught me real-world experience of what really works to reduce pain and actually strengthen and correct the damage in your lower back. After growing and running the Southside office for over a decade, my personal need to expand my thumbprint of the delivery of chiropractic in Western Pennsylvania led me to branch out to work with many of the finest chiropractors in Western Pennsylvania. And since 1997, here's a picture of some of the docs that I've been fortunate enough to work with. We've served over 15 communities and literally tens of thousands of people in Western Pennsylvania. Every day in these offices, thousands of patients are taken care of and lives are being transformed. Now, having spent 30 years in practice serving 15 communities in Western Pennsylvania, I feel that I have a certain expertise that I can bring to this topic of low back pain. So here's what it really means for you on this webinar. My extensive experience focused on helping real patients in the real world. Chiropractic in general has been around since 1895. My family has been serving Western Pennsylvania since 1960. I've personally been serving since 1986, and the reason that we have grown large, successful practices and continue to thrive is that we can get people better in a way that nobody else can. And we'll talk about that a little later, but it has this amazing ripple effect. When you've helped a patient with a condition like low back pain, not only does it change their lives, but it also changed the lives of their friends and their families. When you can do all the things that you need to do and all the things that you want to do, both you and your loved ones know that no matter what, that you are and will be there for them. So any issues that they have, whether it be health-wise or others, any challenges they face that may be decimating for other people, they know that you will be in their corner and have their back and be able to support them and really be able to take things on all types of aspects of your life. So if you could reduce your pain, if you could even live pain-free, shouldn't you at least know? So it's so cool to be able to do what you want in life and really enjoy it in all aspects, and to know that you can come and go as you please. But when you have a condition like low back pain, you know that at any point, any action that you need or want to do can be affected at home, at work, at play. So to overcome that, to be able to feel good and able to function in all the important roles of your life as a child, as a parent, as a sibling, as a spouse, as an employee or a volunteer or an athlete, knowing that you can give 100% of yourself with confidence is a great relief. So I hope to answer some questions about what's wrong, to be able to help you define limits and boundaries, and to be able to match the right treatment with your real condition. So let's talk about a little tour of the lower back. The lower back starts with 5 layers of muscles leading down to some of the bones. This would be the lower part of the spine, the lumbar spine, vertebra in the spine. The tailbone would be below the vertebra. Here are your hips. Now, what's not shown here are some other tissues like the nerves and the arteries and the veins and fat tissues and things like that. But most of the damage happens, as is shown on this slide, in this area of the lower back. When we look at a lower back, and here's 2 x-rays, this one is from behind the person looking through them, and this one is from the side, right? The spine has 3 main functions. It holds us upright. It allows for movement, and it protects the spinal cord and spinal nerves. In order to be able to truly enjoy life, to do all of those things that you need and want to do, you need to have a strong and stable lower back. And what goes in synergy with that are your core muscles or your abdominal muscles. So they're called synergistic, meaning that the low back and your core, your abdomen, works together. I've been able to work with thousands of patients and teach them how to overcome their low back pain. It is a small but growing army of people who really understand how the back works and how to protect it. The first type of injury that we're going to discuss are the discs, and the discs are the shock-absorbing pads that are in between each 2 vertebrae. So if we just look, this is a sideways picture of a lower back. I meant to cover this before, so I'll do it now. From the side, the spine should have curves, as we see right here. These curves add for strength. When you're at a party, the best chips to dip are ruffles because they have ridges. Those ridges add for strength. Similarly, in your spine, the curves add strength. In between any 2 vertebrae, as I said, is a shock-absorbing pad. When 2 vertebrae and 1 disc come together, they form a hole. And out of this hole comes a big spinal nerve, which is a branch off of the spinal cord. And this is going to become important as it relates to pain. So the first condition we're going to talk about is a disc injury. You will hear this referred to as a slip disc or a ruptured disc or a herniated disc or a prolapsed disc. And just having some understanding of it will enable you to be able to use the right term, but also understand it. So this is looking down from the top. This is the vertebra. And then this is the piece of the disc. So in here is the actual spinal cord and then nerves that come out. So the disc itself, the best way to describe it is as a small baggie, a sandwich baggie, filled with jello with a marble in the middle. The marble is not shown here actually. So in a normal healthy disc, this marble moves a little bit and motion occurs around the marble, and also the jello acts as a shock absorbing agent for, even walking, all the pounding that we take as we try to function against gravity. So when a disc becomes damaged, several different things that can happen. The first thing that can happen is that the baggie can be expanded out, like a little bubble can form on the baggie so that the baggie doesn't break and the jello is still within the baggie, but the baggie now has a little bubble in it. Imagine if you did that with a balloon, right? This is actually a true prolapse disc, perhaps, but the baggie is not broken yet. Once the baggie breaks, then that's a ruptured disc or a herniated disc. Slip disc is generic for kind of anything. There's actually a last condition that can happen is that the baggie can break, some of the jello can ooze out, and then the baggie can reseal again, locking some of the jello out, and that is called a sequestered disc. In any of these conditions, the pain is created when the nerve is compressed or pinched or irritated. So you could have a swollen disc you could have a true ruptured disc in any condition where the nerve is not pinched and not really know it. And they estimate that if we did take MRIs on random people, that you would see a lot of swollen discs. Here's an MRI. So here's a normal disc. You can see that here's the disc space and it ends. And then this one is, you can see that it extends out beyond the ending that it should. And you don't need to be an MRI expert. You can take my word for it. But to think about whether your problem is a disc injury or not, walking on your toes or heels might worsen it. It may hurt significantly when you cough or sneeze or when you bend backwards. It tends to be on one side of the body. You may experience numbness on the back of your calf down into the sole of your foot. And oftentimes, walking even just a short distance is an issue. A second type of condition that can cause low back pain is called a facet syndrome, lumbar facet syndrome. So the facets are just part of the vertebrae. So here's two vertebrae, this part here and this part here, and then on the lower one, this part here and this part here are the facets. And they make joints. Here's a picture of the joint. This blue box is showing the joint. And it is where motion occurs is where these joints are. So this can become a little bit dislocated or just out of position and stuck, and that causes a tremendous amount of physical pain as well, right? So a third type of condition is a strain sprain. When we put undue stress on our system, oftentimes this shows up as weekend warriors, right? So they were out at the family reunion golfing, or it was the one time a year that they go to Kennywood, right? Lifting a heavy object while twisting or making a sudden movement or a fall. So strains and sprains tend to be self-limiting. Ice and rest, strengthening some of the muscles if you've strained it really bad is important. But if something isn't getting better and turning the corner over a couple of days, that's a sign that it's beyond something that is minor. And there is a fourth condition that I work with intimately on a daily basis that I want to discuss right now, and that's abnormal spinal biomechanics, or simply put, your spine is out of place, not working right, and ultimately, again, irritating the nerves and causing nerve interference. So as I said, this is a condition that I see every single day in practice. It is the focus that is different from every other type of treatment, and why chiropractic helps people in a way that nobody else can. When the structure of the spine is damaged, as we see here, this should be straight and it is significantly out of place. The hips, this hip is way higher than this hip. The fact that it's out of place, that the structure is altered, means that it can't work right. So we lose the ability to stand straight. Our posture is compromised. We lose normal range of motion. There's a decrease in our motion, and perhaps maybe even more significantly, we lose the protection to the spine and nervous system. So in our biomechanics, when the state of our spine is not normal, it is a major health concern. It is literally your head not being on straight. As I mentioned, when the spine goes out of place, ultimately it can pinch a nerve. This nerve interference is a major cause to low back pain, right? As we saw with the disc injury, same thing if the facet or just the vertebra itself can jam the nerve. But even more than just a pinch nerve here in your lower back, this nerve is connected and part of an overall amazing network of nerves that runs from the brain to the body and the body back to the brain body connection, if you will. And this becomes compromised when these nerves are choked off. This decreases your body's ability to function normally and can lead to other serious health conditions. So in chiropractic, we recognize this condition of when a vertebra in the spine is out of place and the nerve is compromised, We call it a vertebral subluxation, or subluxation for short. And it's the chiropractor's job to find and correct these subluxations. Once the nerve is freed, both the pain that someone may experience and all the other functions where that nerve goes, as well as the communication to and from the brain, are improved. Reducing a subluxation can be life-changing in ways that people never imagine. For example, since the nerves in the lower back also supply the connection to the reproductive organs, correcting the structure in the lower back can have an amazing result affecting women around menstruation issues, even the ability to conceive. So freeing your nervous system, allowing your body to function more the way that it was designed, is the real effect of proper chiropractic care. The opposite, though, when your spine is not taken care of, when it's structurally damaged, over a period of time, it will start to decay and degenerate. In fact, the amount of degeneration that any patient has is a determining factor in how long and how much correction and improvement they can expect. It's important to have current structural x-rays taken standing up against gravity to properly assess the condition in your spine. So understanding what's really going on with your back and how low back pain produced is really important. First, it can provide just that answer as to what's wrong. And I know many patients that don't feel like they ever get to that point. They don't feel that they're well heard, and they kind of walk around all day wondering what's really wrong. Once you know what's wrong, you can both set proper limits and boundaries for what you need and want to do, as well as then apply effective treatment to actually overcome it. So what I'd like to do is to give you some things that you can do at home. These are simple, easy. If you start out with a consciousness of trying to apply these things in your everyday life, you can reduce and overcome acute low back pain flare-ups, strengthen your lower back, reduce the inflammatory process, have less pain and more function. So item number one is to understand and then improve your posture. Standing, sitting, lifting, and sleeping. So first in standing, when we stand, our head should be level on our shoulders level over our hips, our knees and feet straight. From the side, this is very important, our head on top of our shoulders, a straight line from the top of your head through your ear, through your shoulders, wrists, knees, and foot. The most common postural abnormality is that we carry our head forward ahead of our shoulders, creating a tremendous amount of strain at the neck. And this not only can cause neck type conditions, headaches, neck pain, arm pain, but the spine is all connected. And there is a ripple effect all the way down to the lower back. Second is while seating, particularly in a computer workstation type area, the top of your screen should be at eye level. Your chair should completely support your thighs. Your legs should be at 90 to 110 degrees. Your feet should be flat on the floor. Your shoulders should be relaxed and your arms parallel. Your chair should have a backrest, and also your wrist should be in a neutral position. So I would ask you to look at the major place that you sit. Typically now it's a computer. What's 1, 2, or 3 things that you can do to improve your sitting posture? 3, lifting. So they estimate, or there's a saying, that it's easier to injure your back lifting 1 pound 100 times than lifting 100 pounds once. There are many reasons for this, but one is when you have a big heavy lift, you often take the time to stop and think about it. When you have a common everyday lift that you think that you can overpower, we often use the wrong technique. So when you're lifting anything, try to get down low. We want to use our leg muscles. We want the weight of the object as close to our center of gravity, the belly button, give or take, as possible. And then we want to lift with our legs. And in this case, if it's a laundry basket or something particularly, we do not want to bend, twist, and lift. So you want to lift it and then turn if you need to go at an angle so that we're always kind of lifting straight. Really important. Here's for you math geeks, some of the math on the torque in the lower back, but lifting 45 pounds can have 1,220 pounds of torque on the lower back, which is why it is so easy to damage your back when you lift. Let's talk about sleeping, right? So in general, I have a couple of rules about sleeping. The most important thing about sleeping is the sleep and the rest that you get. So if you're sleeping in a poor posture, but sleeping well, you wake up normally rested, that's a good thing. If you sleep how I'm going to teach you on a brand new $2,000 mattress and you can't sleep and or do not wake up rested, it is not a good thing. So we need to find what's good for you. But you should try to sleep each night either on your back with a pillow. I like more of a log type pillow or with a cutout so that your head kind of drops over this piece and that the neck is supported. And then optionally a pillow underneath your knees. Or on your side, again, with the pillow supporting the neck, so your neck is neutral, it's not tilted up or down, and optionally a pillow underneath your knees. So what I teach people is to sleep or to go to bed each night in either of these two positions, and when you're annoyed, flip to the other position shown here. And when you're annoyed again, if you're not sleeping, then sleep however you're comfortable and sleep. But if you work with this in just a short period of time, a couple of weeks, 2 to 3 weeks, you can actually teach yourself a new habit. And a better sleeping posture is a great gift to give yourself. So in addition to your postures, I would have you look at your mattress. So any mattress older than 10 years really should be evaluated. Having a mattress that supports you when you sleep and a little cloud that you're sleeping on is important. I don't sell mattresses in any way, but I do think having a strong mattress is important. As I said, a pillow, there are many different type of cervical or neck supporting pillows, but you can take what you have right now and roll it up so that it's more like a log and again support your neck. But you don't want to have 3 pillows pushing your neck way up, or if you're on your side, imagine having, pillows crunching the neck over to this shoulder. Now, the sleep environment that you're in, if you're in a position to both reduce the light in your room, reduce the noise in your environment, so that we're sleeping in a calmer, more stable environment, it can be super helpful. If you go to sleep every night with music or the television, whether it turns off or runs all night, I'd really encourage you to try to move towards getting away from that and to be having a deeper rest and more sleep. And then almost universally, my patients need more sleep. I think as adults, I think that when we're around children and we're really primary caregivers, we see the need for extra sleep. It's visual, it's easy to assess, but it's not as easy to see it in ourselves. So even an extra 30 minutes can make all the difference in the world. So I would encourage you that for the next 6 weeks, you go to bed 5 minutes earlier progressively each week. And you may not be able to do that every day, but if you put a consciousness to it, you will be able to go to bed earlier and gain an extra 30 minutes of sleep each night, which can have an amazing effect, not only in general, but specifically overcoming any health condition like a low back pain. When you're able to fully function without worrying about your health, you can then excel in all areas of your life. And it is great and provides a confidence to know that you'll be able to do what you need to want to do to create the things that you want in life. Your house, your home, your career, where you want to go on vacation, to plan a life of joyousness and love. So we talked about better posture, better sleep. Third is, as I mentioned earlier, this is a gift that I have for you. Everyone with low back pain, everyone in general, but particularly if you're already having low back pain, should be doing stretches. And this PDF starts with 5 simple but powerful stretches. You can start and do it as little as 3 minutes a day, working up to an 8 to 12 minute stretching routine, even a couple of times a day, can really help the lower back and core. So doing daily stretches is really important. Ice therapy. So particularly when you're in an acute flare-up of low back pain, I'd like you to put ice over the painful area, 20 minutes on, 20 minutes off, 20 minutes on, so 40 minutes out of an hour, and 2 to 3 times a day, right? So this is a pretty aggressive ice therapy, and doing that will allow the inflammation to come down a little bit and should help you with pain. Do not ever put ice directly on your skin. So this is the blue reusable kind of low back ice belt. If you have access to one of these, it's great. If you don't, it's not a problem, right? So again, if you were to just fill up baggies with just blocks of cubes of ice, wrap that in a towel, and you put it right on your lower back. So, instant ice bags are also fine. Whatever you have access to is a good thing. Here's another home recommendation I think is critically important in the overall healing process, and that is to hydrate yourself. So I'm recommending that we drink 64 ounces of water a day. That's 8 large glasses of just water. You don't need to go out and buy water. You can drink tap water. And it's particularly important. It's important when you're injured, when you're damaged. It helps the body to eliminate all of the stuff that it needs to eliminate. When we're sweating more, obviously we need to replenish ourselves. Before a meal, it can act to fill you up a little bit. If you're trying to watch calories, it's beneficial there as well. So really, I typically encourage all my patients to hydrate better. So those are some home tips, right? If we can reduce and overcome a low back flare-ups, start to strengthen the low back and core muscles, reduce the inflammatory process, you can become more independent, have more confidence in your body's ability to function the way that you need it to. Being able to do it yourself at home is definitely more cost effective, right? And, it creates more independence. You reduce your dependency on any over-the-counter drugs or medications or anything else in terms of care. So sometimes, though, that doesn't happen, and you really need to seek out professional care. And what I want to do is quickly review the current treatment options to help you understand. Understanding the true cause of your problem can lead to getting the right treatment. I want you to understand the risks and side effects, and why the wrong treatment only lets your body get worse. When you understand this information and take the correct action and really overcome your low back condition, you'll become one of my Purple Hearts. It feels so good to be one of the ones that others will look to know that they're watching you, that they're inspired by you, and to realize what you've overcome and who you really are and what you're all about. So I'm looking to grow this community of my Purple Hearts to spread this message that I think is poorly understood. The first thing that I see happen with people that low back pain is that they do nothing, either because they're in a position where they can't stop doing whatever it is that they're doing in their life, work-wise, parenting-wise, other roles that they have, or they just won't, and they're stubborn, and I think we all know somebody in our lives like that. So they just keep grunting it out, and they maintain their normal activities. The challenge with this is that the underlying damage, the pain that is causing the pain again is just the indicator light in your car, right? Check engine. When that comes on after something has gone wrong. The pain in our body comes on after there's an underlying damage to it. So ignoring the check engine light, ignoring your pain will tend to only allow the condition to drag on and slowly get worse. So almost always doing nothing is not an effective form of treatment. The second thing I see people attempt is to recognize that they're in an issue and then to apply rest. So either light duty or off of work completely, and either be bedridden or, sit around in a chair all day long. And while it is often appropriate to reduce or to set boundaries on your activities, I'm going to recommend against full bed rest. So getting up and staying mobile helps to reduce scar tissue from forming. It helps to reduce the fixation or the stuckness in your spine. And then there are many other systematic reasons why moving around is healthy, right? So rest, you want to do it appropriately. The next course of action I see that people go to are over-the-counter medications or drugs, typically in the form of either anti-inflammatories, muscle relaxants, and then some other combinations as well. And oftentimes it may help to reduce and relieve muscular pain. Oftentimes, sometimes even some nerve pain. But ultimately, what I really want you to understand, if this was the only piece of information that you took from this entire webinar, is that when you take any type of drug and you no longer feel the pain, in the vast majority of these situations, the drug is merely masking the pain, leaving the underlying damage unaddressed and slowly degenerating and getting worse. So again, it would be as if the check engine light came on in your car, and instead of addressing your engine, you reached up underneath and pulled out the bulb to the check engine light. Until you go in and really assess that engine, the damage is slowly going to get worse. Now, not only is that an issue, but the CDC's latest figures show that yearly, 16,500 people died from overdoses for these common pain relievers, right? In 2010, 40% of those were women. Once over-the-counter drugs don't work, then people seek out prescription drugs. And Americans consume 80% of the world's supply of painkillers, more than 110 tons of opiates a year. It comes out to $325 billion, or about $900 a year in drugs, in pain-related drugs, for every man, woman, and child in America, right? So other challenges, even when taken under doctor's orders, is that they are often prescribed off-label, meaning there is no research to support their use in your condition. And there's tremendous side effects with many of these drugs, leading to dependency and perhaps even organ failure and death. Another way to deliver some drugs is through injections, nerve blocks. They attempt to inject a steroid directly into the location of pain. And again, this acts, even when it works, just to mask the pain. So if you're a stealer and you need to perform on a given Sunday, and you get a nerve block so that you don't feel it and you can perform, that's a trade-off that you're making in your chosen career. But to be living every 6 weeks on injections should be indicative that there is an underlying cause that's not getting addressed to. So oftentimes people will get diverted into a course of physical therapy, PT, and typically it's exercises and then some other machines, modalities to support their type of injuries. And for joint instabilities, for ligament damage, some strains and sprains, shoulder injuries, knee injuries, elbow injuries, there are lots of conditions where physical therapy is my preferred choice of care. I've been a physical therapy patient several times in my life. After shoulder surgery, it was really helpful. On a foot condition, it was a little bit helpful. And for the right conditions, it can be very helpful. However, in the low back, oftentimes physical therapy will not address the true underlying structural problem, leaving your spine weak which is why the therapy never actually, because the therapy doesn't get to the root cause, you don't ever overcome your condition. The major form of care that we're all kind of concerned about, of course, is surgery. It's estimated that there's 600,000 spinal surgeries a year. The numbers vary on this. Between 50 and 90% are estimated to be unnecessary. Perhaps even worse than that, 50 to 75% of these surgeries end up being called failures. The pain comes back within a short period of time. But this does leave a small percentage of people where surgery is the right answer. And the way that we think about it is to go natural first, chemical second, surgery last. So I think oftentimes in our society we get backwards on that, and we want to rush, and once you have surgery first, you can overcome it, but it's much more difficult. If you can avoid surgery, it's a strong recommendation. So the question becomes then, what is an effective form of treatment for low back pain, this endemic that affects 80% of us, help the major cause of disability, the major cause of chronic pain? And what I want to introduce to you is this work of spinal rehabilitative care, where we address the underlying structural damage of both the spine and the pressure on the nervous system. So in this particular case, we see that the low back is tilting over here to the right. And this is the before, this is the after picture. And you can, if you measured, this isn't even perfect, but just visually, you can see that this is much straighter. So to explain it on the simplest terms, spinal rehabilitative care is about assessing what is the condition of your spine compared to normal, and what can we do to make it more normal, right? So we do that through three things. We exercise it, adjust it, and provide traction in what we call mirror image. So if something is bent to the right, we would want to bend it to the left. And it is under spinal rehabilitative care that we actually see spines correct, that with exercise, both the low back and core muscles strengthen, and you can overcome your condition, live with less or even no pain in a reasonably short period of time. So, understanding the true structural cause of your pain is the key to getting important care. Knowing the risk and side effects of each treatment is also critically important, and I think really not well communicated. Ignoring or attempting to apply a non-structural treatment to a structural problem can lead to ongoing and worsening problems. And if I had to sum up the biggest healthcare concern based on all of my experience, being responsible for tens of thousands of lives, it's this. In our society, we want to seek a chemical answer for a structural problem. And that's like trying to force a round peg into a square hole. So what I hope to achieve is to provide you some understanding of what's going on with all of these low back conditions, to provide you things that you can do at home today, other options if that is not enough, so that you can live with less pain and more health in your life. It's sort of sad how many of my patients I've seen get stuck in a long history of low back pain that spirals out of control and ends up affecting everything in their lives. Work, family, friends, hobbies, right? All affected with their low back problems. It's nice to know that with an effective treatment plan, you can not only have less, even no pain, but you can get to a point where you can truly correct the underlying damage, and then you become a Purple Heart, one of those people that you're in a place where you need not worry about your low back any longer. So I've received a couple of questions. I'd like to take the time to answer them. One is, how much time does it take? And that's a common question, and it's going to depend on a couple of things. The first thing that it depends on is the condition of your spine, how much damage is in your spine, how many bones are involved, how much degeneration is involved, how bad out of place, and all of this can be determined in an evaluation. Typically, in a couple of weeks, patients know that they've turned the corner. They have less pain and more function. Depending on your condition, it can go from a couple of months to an extended period of time to reach maximum correction, right? A question about being worried because they've tried everything and they've been told that they should, that everything has been tried. So I hear that a lot as well. I feel the concern that you have. And I want to tell you that if you've not had a spinal structural examination, that you have not tried everything, and that there is still hope for you in overcoming your low back pain. Another common question just came in, can I afford it? Again, it's putting the cart before the horse. Certainly, there's always money involved in healthcare, but we don't know whether we can help you yet or not. While we are network providers for most major insurers, my concern is to see if you have the condition that we can help, which is why, as I promised, I want to give you a couple of things. So as I mentioned earlier, I want everyone in attendance to get the 5 stretches for low back pain. I provided a link that you can click on to get that free PDF. But if you're fed up with your current back pain, if you feel that no one really has listened and heard your whole story, if you think that you've tried everything and you're at wit's end, and if you just want a professional opinion of the actual structural status of your low back, I want you to be able to get it. I want to remove all the barriers from you being able to determine, for you to see for yourself once and for all what's causing your low back pain. So we've created our webinar special 2-day invitation to health offer. You get a personal consultation with the doctor. We will do our 66-point in-office structural examination. It evaluates all the muscles, bones, and nerves. If indicated, we will take any of the spinal x-rays necessary to assess your spine. And then we will sit down with you and show you everything that we found and outline, if we think that it's in your interest, a course of care, first to get out of pain, and then to strengthen and correction the damage in your lower back. So typically it's a $399 value. However, because you've attended this webinar, you've put your hour in today, I want to make sure that I remove as many barriers as possible. And we're going to offer it to you for just $49. And you'll see a link come up for that. And I really want to encourage you to schedule today. Here's why. That low back pain is a serious problem. Generally, it's not going to go away on its own, right? I particularly want to reach out to those of you that have been told that, or you think that you've done everything and there's nothing else that you can do. Right? And again, for attending the webinar today, I'd like to make this special offer for you. So if you're even a little on the fence, I would encourage you to click the link and schedule your appointment today. When you wait, not only do you get good at waiting, but it allows for your low back condition to drag on and get worse. That means typically more episodes of pain that last longer and are more severe. If you can be helped, if you can turn the corner and really fix what's causing your pain, shouldn't you at least know? You can be like Jessica. Jessica was having low back pain 7 out of 10. She was using the ice, doing stretches, and just like I taught, had both over-the-counter and prescription pills. And within 3 weeks of care, her condition went down and she was a 2 or 3 out of pain. If you go to our website, you can see her video story. Or Jeremy. His fiance was sick about him always complaining about his lower back. Again, in just a couple of weeks, he turned the corner. He was able to do more actions that he needed and wanted to do, right? Now, it's important. I want to make sure that I remove every barrier possible. By now, you know the type of person that I am, right? I don't want you to have anything that you don't want, but I also don't want you to have any regrets. So what I'm asking you to do is to say maybe. I know what sort of things happen in my life, and I know that if you don't take action right now, that if I didn't take action at key points in my life, things would be totally different. So I want you to encourage you to take this action in the strongest possible way. You're certainly not committing to anything beyond the evaluation or any additional care. You're just saying that you want a structural evaluation. If you can be helped and you can leave all your pain behind and live a more joyous and more pain-free life, shouldn't you at least know? So what I do want to guarantee is, we can't guarantee a health result, but I can guarantee these three things. One is we can guarantee to respect your time. You will be seen within 7 minutes of your appointment, often right at your appointment. You will be treated as a special one-of-a-kind human being, not merely the next case of low back pain to us. We will give you our honest opinion. If we think that we can help you, we'll tell you. If we don't think that we can help you, we'll tell you that too. And in fact, under my theme of removing all the barriers, what I'm going to do for attendees today for the next 60 minutes is not only will you get our whole deal, a personal one-on-one consultation with the doctor about your health, the severity of your problems, things that you've tried to do, things that we want you to do. We will do our in-office evaluation, our 66-point test, evaluating all the muscles, bones, and nerves, check the range of motion, and evaluate your spinal health and function. If necessary, we will take all spinal x-rays using our state-of-the-art structural measurements and then sit down with you to provide a complete report of findings. And you'll learn what's really causing your pain and if we think that we can help you. As I said, it's a $399 value. Typically on a webinar, I'll offer it for $49, but to remove the last barrier, if you click this link and schedule within the next 60 minutes, we'll provide this at no charge. So that's the offer. Again, if you have some additional questions, please feel free to add it into the chat comments. We are off to a great start. Many of you have taken advantage and are scheduling your appointments. That's great to see. Having this evaluation really is the only way to determine if we can help you to reach your health goals. If you've not clicked on the link yet, you must be the type of person that likes not just the deal, but the amazing deal. So fine, let me make sure that you're taken care of as well, and I'll tell you what that means on this webinar. So for scheduling your appointment during the webinar, fast action bonus number 1 is a 30-minute therapeutic massage, deep tissue massage with specific instructions from the doctor on which muscles to focus on. Therapy is designed to relieve tension and pain, but to still be enjoyable for you. I've also made an arrangement with BodyTech Gym to provide a 1-day pass at their gym, have a tour and to be introduced to their equipment. And again, we will work with you to provide an appropriate level of exercise for your back. So this is the second bonus. So the overall webinar special is the full one-to-one consultation with the doctor. We want to hear all about your health, all of your struggles, everything that you've tried, everything that you've been told, any medications that you're on. We want to have a full understanding of what's going on with your health. We will perform a complete chiropractic, orthopedic, and neurological examination. It will help us to determine the health of the joints in your spine, how the muscles, bones, and nerves are functioning, and if we think that we can help you. And if it's necessary in your case, we will take all the necessary spinal x-rays, analyze them both for position and health so that when we sit down with you to do our complete report of findings, we will show you piece by piece what's really going on in your back. And if we think that we can help you, we'll make our best recommendations. In addition to that, a 30-minute deep tissue massage, a day pass at BodyTech, and of course, everybody has access to 5 stretches for low back pain. So it's a $585 value that we're happy to offer to you for the next 60 minutes at no charge. So again, I'd like to thank all of you for attending tonight. For those of you that I didn't get to your questions, look for an email. Again, thank you very much for attending this webinar. If you haven't scheduled yet, maybe you're one of those people that is just a natural skeptic. So you think that those chiropractors, once you start going, you have to go forever. I want to assure you that in our office every day, we work as a team with our patients to decide what's our patient's goals and to give them options so that they can pick the best course of care available to themselves. Or maybe you're still hesitant to register because you're worried about the safety of chiropractic. And that's a legitimate concern that you should have with any form of treatment. And I would argue that chiropractic is some of the most safest of treatment, as reflective by our malpractice rates. So you might be interested to know that a full 30 years into practice, the most malpractice that is available to me still costs under $2,000 a year. And again, that's reflective of the true risks in the marketplace of receiving chiropractic care. Lastly, you might be concerned because of the hassles of coming and waiting and to and fro. And I want to encourage you to set aside any concerns that you're having. If you're suffering from low back pain, if you don't have a next place to turn, I want you to commit 2 days of your time to see what the real condition of your low back is. And again, if you could live with less pain or a pain-free life, shouldn't you at least know? Thank you.